Ladies and gentlemen, people that are suffering from chronic pain are now having a hell of a time finding a doctor, especially if they have to switch to a new doctor for one reason or another, a doctor retiring, or they might have relocated and need to find a new doctor. A lot of times, these doctors will not help patients even if they have a prescription for opioids. They're shit out of luck. This came out in Xpress, August 14th, 2019. Many doctors are refusing to care of people prescribed opioids. Folks taking opioids for chronic pain may run into trouble if they need to find a new doctor. A new secret shopper survey of 194 Michigan primary care clinics found that as many as 4 out of 10 primary care doctors would turn away patients who have been taking the pain-killing medications such as Percocet long term. And that's true even if those physician practices said they are open to taking new patients. This is a prevalent problem, more so than we expected, the study author, Dr. Pooja Legisetti from the University of Michigan Medical School and VA Ann Arbor Healthcare System. For the study, researchers called physician practices posing as a potential new patient. The patients explained that they were taking opioids for chronic pain and that they had either Medicaid or private health insurance. So it doesn't even matter. They don't care what kind of insurance you have. Many of these doctors do not want to take the risk of writing all those scripts. Number one, they don't want to be jailed. There have been many doctors jailed after being told to cut back on prescribing so many opioids, and they continue to do so. They are now paying the price for that. I hope it gets physicians thinking, what can we do better? By closing the door on patients, we are not helping anybody, she says. We need to dig into the problem to find out what's driving it. Fear. These doctors don't want to lose their license, and they're not going to lose it over these patients. You know, they don't want to be seen as writing a bunch of scripts for opioids anymore. Stigma is probably a component, and another big component is probably the administrative burden that comes with prescribing opioids. It's not a trivial amount of work to manage someone on opioids safely. I suspect some clinics may be a little overburdened, she said. Dr. Noel Deep, a spokesman for the American College of Physicians, suspects the problem is less about stigma and more about the regulatory burden related to prescribing opioids. Physicians have to think twice when prescribing opioids, and if you're in a small rural practice, it gets difficult. Physicians can also be targeted for overprescribing, he said, and I believe that's the root cause of them turning so many people away, y'all. I really do. These physicians do not want the stigma of overprescribing meds, especially opioids, to patients, because then they can easily be investigated. Okay. Dr. Yili Huan, director of Pain Management Center in Northwell Phelps Hospital in Sleepy Hollow, New York, agrees that opioid regulations might make physicians hesitant to take on a patient who's using them, even if that patient doesn't have an issue with addiction. While people taking opioids are at a very high risk of misuse or abuse, Huan said About 3/4 of people who take them don't misuse them, and about 90% don't develop addiction. He did note, however, that many people can have their pain successfully managed without opioids. Well, you got to do something, because if you don't help these people in chronic pain, then they go to the illegal drugs. And if they go to the illegal drugs and get busted, then you want to jail them. And that's the problem. You want to come down on the doctor for too many opioids, and then when they go for the illegal drug, you want to blame them for that. Woo, the system must go. But those who need them, the increased scrutiny and potential risk to a doctor's license and livelihood may keep them from taking on these patients. So, what can happen if people treating chronic pain with opioids can't find a doctor? Well, they may be out of luck. They may be out of luck. Laggiasetti said patients could be left with uncontrolled pain and may have withdrawal symptoms. If they attempt to see several doctors for opioids, they may be labeled as a drug seeker and have difficulty accessing their pain medications. For those who are abusing the opioids in some states, they won't have access to the medication that can reverse an overdose. Wow. So not only are they taking the, wow. So not only are they labeled as a drug seeker, they can lose access to even get Narcan. That's deep. He noted that patients might end up driving long distances to seek pain relief. Some might even use illicit drugs. No, they will. They will. If you don't come up with an alternative, they will. And you know what? That's shocking to me, ladies and gentlemen. This addiction has gone on for 20 years and they don't have a good alternative yet. In 20 years? I mean, really think about that. 1999 is when this addiction was first noticed among patients. We are in 2019 and they still have no alternative. That's what's happening. Wow. While around 40% of doctors turn chronic opioid users away, 60% were willing to see them. Huan added, despite increasing regulatory scrutiny, many providers continue to care for patients on chronic opioids. The study found no difference in whether doctors would see patients based on the type of insurance they had. This suggests that there may not be any financial or discriminatory incentive behind these actions, and instead, turning these patients away is driven solely by fear of policy repercussions and lack of education, Huan explained. All right. So, ladies and gentlemen, I feel for these people that are in chronic pain, the ones that really need it because of an injury or even botched surgery can put you in that position, or it could be a job-related injury, one reason or another, but they need the painkiller. It could be a car accident. You just never know. It could be for many reasons. But I do believe that everybody is out, everybody's not out here to abuse drugs. I think some people do, and I think some legitimately do not abuse these drugs, and they need it for pain. But please tell me what you think, ladies and gentlemen, about this story of doctors refusing to care for patients that have prescriptions for opioids. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.